Hey, and welcome to Medibles, where I talk about medicine, mindset, wellness, and so much more. I hope you stick around with me and learn something new today. Now let's take it to the whiteboard, and I'll reveal some interesting facts and misconceptions about depression that you might have never heard before. Depression is one of the most common mental health disorders experienced worldwide. Approximately 5% of adults suffer from depression, and the prevalence is highest in individuals between the ages of 18 and 25. It has also been found that women are approximately 70% more likely to suffer from depression than men, which is thought to partly be due to fluctuations in hormones. Unfortunately, depression is not always obvious simply by looking at someone because although they may appear happy and cheerful on the outside, they may be struggling behind closed doors. Depression can result in long-term alterations to the brain structure and chemistry. Depression causes decreased activity in a part of the brain known as the hippocampus, which is responsible for learning and memory formation. Depression also results in a decrease in a number of neurotransmitters such as dopamine, serotonin, and norepinephrine. Depression has also been shown to be linked to other health conditions as well, such as autoimmune disorders, heart disease, and diabetes. It has been proposed that depression can result in an inflammatory state, although more research needs to be done. Although it is difficult to pinpoint the exact cause of depression, there are a number of factors that are thought to come into play. Some of the major predisposing factors that are thought to come into play include having a family history of depression, stressful life events, and a lack of a social support system. Depression is known to affect all areas of life. The initial symptoms of depression may be attributed to other causes. However, as symptoms progress, they can interfere with normal daily functioning and close relationships. The symptoms of depression can be remembered by the mnemonic SIG-E-CAPS, which was first created by Dr. Carey Gross. Some of the symptoms of depression include sleep disturbances, lack of interest in activities someone once enjoyed, guilt, lack of energy and fatigue, diminished concentration and focus, which can affect areas such as work and school, appetite and weight changes, psychomotor agitation, and thoughts of self-harm. At least 5 of these symptoms must be present for a period of 2 weeks to be officially diagnosed with depression. Hey, your friendly neighborhood doc, just checking in. If you feel that you may be experiencing any of the symptoms described in today's video, please speak with your doctor or licensed mental health professional. Luckily, once depression is diagnosed properly by a licensed health professional, it can be treated with a combination of the right medication, therapy, and lifestyle changes. Did you know that doing 30 minutes of exercise on most days of the week can help lower the incidence rate of depression by 12%? This is thought to be because exercise releases some of the same neurotransmitters that are seen to be decreased in patients with depression. Although antidepressants are the standard drug of choice for depression, different medications work for different patients. Patients may need to try more than one antidepressant before finding the one that works best for them. Antidepressants along with therapy have proven to be more effective than just antidepressants alone, and for some patients with mild to moderate depression, therapy alone may be enough. It's a common misconception that once a patient starts medication for their depression, they will need to be on the medication for the rest of their life. However, this is not true. Antidepressants take about a month to start working effectively. The patient is usually placed on them for about 6 months to a year before discussing the possibility of tapering off the medication. That's all from me today, but if you're enjoying this type of educational content, be sure to like and subscribe to stay tuned for much more to come. If you have suggestions on what you would like to see next, drop them down below in the comments and I'll try to make a video on it. Until next time. Bye.